Hello, I'm Dr. Richard Gould, Associate Medical Officer of Health for York Region. We know parents and families are having discussions about the upcoming school year as school boards and private schools continue to announce their reopening plans. Whether you are deciding to send your child in school in person or to participate in online learning, please know York Region Public Health will continue to play an active role in helping to limit the spread in schools and will continue to investigate all cases of COVID-19. We have added a section to our york.ca website to help support the transition. When you visit the webpage, york.ca/safeatschool, you will find resources, fact sheets, signage, and frequently asked questions to help you prepare. We're updating the page regularly with information, so please check it often. Last week, the province released the COVID-19 Guidance School Outbreak Management. The guidance document provides information for local public health units to guide the investigation of cases, outbreaks, and suspected outbreaks associated with elementary and secondary school settings, including kindergarten to grade 12. It is intended to supplement existing public health guidance on the management of cases and contacts of COVID-19 in Ontario. These guidelines are consistent with our existing long-standing role in managing outbreaks of infectious diseases in the school community. York Region Public Health continues to work with the public and Catholic English and French school boards, as well as private and independent schools, to implement the provincial standards and guidance to support the reopening of schools. Keeping COVID-19 transmission low at the community level will be key to preventing the introduction of the virus into schools. Our primary goal is to make the return to school as safe as possible, balancing the risk of COVID-19 transmission while also reducing other harms to the well-being of students, teachers, families, and support staff. For York Region Public Health, this means supporting our school boards in their reopening plans by providing public health information and supporting implementation of provincial standards and guidance. Sharing information with the schools community, providing infection prevention and control advice to schools for both in-school and transportation scenarios, managing COVID-19 cases and outbreaks in school settings, supporting testing and surveillance of the school population, providing ongoing support through a dedicated public health nurse who will be assigned to an area of schools and can assist in responding to specific school inquiries and make regular visits to the schools. Public Health has a collaborative history of working with schools in York Region related to communicable and infectious diseases. If a student tests positive for COVID-19, York Region Public Health will conduct an in-depth case investigation to identify contacts of the case. In the school setting, contacts are likely to be students and the teacher in the same cohort, siblings of the case in different grades, and/or any school staff who interacted with the case's cohort while the case was infectious. Other contacts outside of school would also be investigated, such as household contacts and any other place the case may have visited while infectious. Public Health will directly contact potential contacts of a confirmed case to advise on testing and self-isolation and/or self-monitoring. This may be in the form of a phone call or a letter to those potentially exposed. We will also communicate with students, parents, and the school so that they're kept up to date on cases and investigations. School will look and feel different this year because students in high school and some in elementary school grades are required to wear a mask or face covering. Parents are asked to help their child to get used to wearing a face covering, and this includes putting it on, taking it off, and storing it safely. On our webpage, york.ca/safeatschool, you will find instructions on how to properly put on a mask. We have been asked by some parents why children in younger grades from kindergarten to grade 3 are not required to wear a mask. We strongly encourage students in these grades to wear masks if they are able. However, younger children may find it difficult or uncomfortable to use face masks or coverings and may want to fidget with them. They may have difficulty safely putting it on or taking it off without the assistance of an adult, or may not be able to wear it for the entire school day, a long school day. This could increase their risk of contamination, outweighing the benefit intended with mask use. From the evidence we have seen so far, younger children are at lower risk of becoming seriously ill and are less likely to transmit the virus. If your child will be attending school in kindergarten, grade 1, 2, or 3, think about the right choice for your child's individual needs and whether they are able to safely wear a mask without help putting it on, taking it off, and storing it when soiled. Getting children back to school is important to support their social and mental well-being. We can work with your school to help make sure they get the support they need. Also, remember to teach your kids to be COVID smart to help them stay safe this fall. In this case, SMART stands for stay home if you are feeling sick, make space around your friends and wear a mask, always wash your hands with water and soap, remember to cover your cough or sneeze with your arm, talk to someone you love if you are feeling sad or scared. Every one of us doing our part will support a safer return to school. Remember, there's a lot we can do now to ensure our community rates stay low. Our cornerstones of prevention remain frequent and thorough hand washing, maintaining physical distancing with anyone you interact with outside of your immediate social circle, and immediately self-isolating and getting tested at one of our 3 COVID-19 assessment centers if you become unwell. Beyond this, getting lots of sleep, regular exercise, reducing or stopping smoking, talking to your healthcare provider about supports for this and enjoying the outdoors and time together safely can help support a strong immune system. Thank you and stay safe.